And amid all that noise, the government did have some good news today. Legislation to means test the private health rebate has passed the lower house by a single vote. The move will save the government nearly $2.5 billion over 3 years. But healthcare experts want to know how the savings will be spent, and the opposition has pledged to overturn the law if it wins government. Brendan Trembath reports.
The cost of healthcare is a national headache for households and governments. The federal government says one of the fastest growing costs in its health budget is the private health insurance rebate. But under new legislation, which has passed through the House of Representatives, fewer people will be eligible to receive the subsidy.
The passage of these bills will mean that the taxes of a bank teller will no longer subsidise the private health insurance of the bank executive or the bank CEO.
Singles on at least $83,000 will see the rebate cut to 20%. Above $93,000, it's slashed to 10%. Around $129,000, the rebate disappears. For families, the rebate is means-tested from $166,000. Ed Walton is 30 years old and he's been privately insured for as long as he can remember. He has a well-paying job as a policy officer. Under the proposed legislation, he'll face the means test.
Well, I'm a little bit disappointed, to be honest, because I would consider myself a middle-income earner, and they've stated that these reforms are aimed at assisting middle-income earners.
Ed Walton is in pretty good health for now.
I generally don't use my private health insurance very much. I have it because I think I can afford to pay it, so I do hold it. I would generally use it if I go to visit the dentist for a regular checkup, or if I require something like when I went to the physio a couple of weeks ago because I hurt myself while keeping fit.
Labor governments have always fought for the rights of working people to have access to high-quality health care, and will continue that fight because it's right, because it's what Labor governments do.
The result of the division is Ayes 71, Noes 70. The question is therefore resolved in the affirmative.
The federal government says the legislation will save taxpayers $2.4 billion over 3 years. It might be a saving, but the opposition wants no part of it.
I can remember John Howard coming here to
Will you repeal this if you are the Prime Minister the next time we go around?
OK, the private health insurance rebate is an article of faith for the Coalition. It is an article of faith for the Coalition. Private health insurance is in our DNA. We will restore the rebate in government as soon as we can.
This sounds like another aspirational promise from Tony Abbott. He needs to come clean. Will he add to the $70 billion black hole that the opposition has already dug itself because it's happy to promise repealing measures, but it simply won't tell us where they plan to cut?
The rebate was introduced during the Howard years.
You have the introduction of a 30% tax rebate for private health insurance. If you've got a $2,000 policy, doesn't matter what your income is.
It's been bad policy from day one. The Howard government believed that taking money out of the health budget for hospitals and putting that into private health insurance would see a massive swing of people deserting the public hospital system and taking pressure off them and going to private hospitals. Just didn't happen.
John Dwyer says reducing the rebate is a step in the right direction, but he wants to know where any savings will be spent.
I would argue, as would many others who are looking at our healthcare system carefully, that that money was stolen from health. It should be returned to health, every single dollar of it, and there are numerous ways that we could use it.
The Minister has only spoken in general terms about where money will be spent.
This is about building regional cancer centres, it's about training more GPs, it's making sure that every health dollar is spent in the best and wisest way, and subsidising the private health insurance of higher income earners is not the best way to spend the health dollar.
The government will say an extra $165 million will go to dental care.
To people on waiting lists for dental services, terrific, it's a great idea. We need massive injection of money into this. But I am suspicious that, worried that a lot of it's just going to go back to consolidated revenue, to try and see us get us back to surplus faster.
Effectively, the government will be able to go back in the black, into surplus, by virtue of millions of Australians going in the red by virtue of having to pay more for private health insurance by losing the rebate. So that worries me.
Some are concerned that if the rebate is removed, people might vote with their feet.
When people drop out of the private health system, it is exceedingly difficult to get them back into the private health system, and that is why it's important not to fix something that ain't broke.
The government does not agree that hordes of people will abandon the private health system. The government says the industry's own figures show record numbers of Australians are signing up for private health insurance. The real test begins from July 1, when the means test is due to begin.
Brendan Trembath with that report.